Hi, welcome to the section of cardiology. This is Dr. Jaitly. Here I'll be talking to you as a follow-up of what is valvular regurgitation and stenosis. It's a follow-up of the previous video clip. Now, just to refreshen, regurgitation of the valves implies that the blood is returning backwards into the previous chamber. That means the valve was incompetent, and when the ventricle contracted, some of the blood returned back. Stenosis implies when the blood is not able to pass through that orifice because of the narrowed valve. That is called stenosis. Okay, so in both the valve conditions, obviously the heart has to work harder. So let's refresh again one more time. Concentrating on the left side of this heart here on this schematic, the left atrium squeezes into the left ventricle. The blood passes through the mitral valve. Again, this is a normal phenomenon, normal valves. Now the left ventricle in turn contracts and squeezes the blood up into the aorta. So the aortic valve stays wide open and the mitral valve stays shut at that point. So that's a normal phenomenon. Now, if there was a stenosis and a regurgitation to occur on this side, let's see this schematic here on the right side that I've shown. Now here what I've shown is the mitral valve is stenosed. Why? Because it's very thickened and fails to open fully. So now when the left atrium is contracting and trying to send the blood into the left ventricle, you see these blue arrows, it's trying to send all of that blood through it, but only small amount of blood comes into the left ventricle because the valve does not open wide. That's called stenosis of the mitral valve. So when you have a stenosis of the mitral valve, the left atrium will dilate. Why? Because obviously not much blood is coming to the left ventricle. So some of the blood will remain here and more blood will again flow back into the next cardiac cycle. And the beat goes on and on. So the left atrium will start enlarging. In fact, some of the largest left atriums ever seen in human beings is in this condition called mitral stenosis. Just make a note of it. If somebody asks you a question, where do you see the biggest left atriums? In which condition? It's the mitral stenosis where you see the biggest left atriums. Okay, and that's for a reason. And the left ventricle stays small. Why? Because the left ventricle is only receiving small amount of blood here. And that goes up into the aorta when the left ventricle contracts. But the fact is that more blood is retained into the left atrium, failing through the mitral stenosed valve, not be able to pass through. Now, in this setting here, let's move on to this section of the busy slide. The left atrium is of normal size. The left ventricle is dilating. Why? Because the aortic valve is incompetent or regurgitant. So now what happens is when the left atrium contracts, okay, so the mitral valve will stay open, left ventricle contracts, the mitral valve will stay closed, and then the left ventricle will try to empty it into the aorta. So when it empties into the aorta, some of the blood is returning back, which is not good because when the ventricles begin to relax, these valves should close. The aortic valves should close. And that'll prevent normally the blood returning back into the left ventricle. So as a result of aortic regurgitation, when the valves are not closing fully, portion of that blood is returning back into the left ventricle. So the volume of left ventricle again increases. So what have we seen? We have seen mitral stenosis where the blood is not emptying out fully from left atrium to left ventricle. As a result, there is left atrial dilatation. And on this side, we have seen aortic valve, which is not closing fully during the time of diastole. As a result, some blood is returning back into the left ventricle, and you have aortic regurgitation and a left ventricular dilatation. So I hope it was not confusing, and I've tried to make it as clear as possible, even though these are very intricate valvular conditions as we move forward into even further intricacies in cardiology. Okay, so please feel free and enjoy this knowledge and share it with your friends, and we'll get more interesting as we go along. But remember, these mitral stenosis and aortic regurgitation murmurs are diastolic murmurs because they are occurring in diastole.